Constipation is a very common problem amongst a lot of young children, primarily because there are certain anxieties surrounding toileting, especially when it's outside their home and their familiar surroundings, which can precipitate constipation. So it's something that is encountered quite often in primary care. The management of constipation is primarily determined by whether there is any impacted stool or not. So when examining the child, you may be able to feel a sort of mass, a fecal mass, most probably in the left iliac fossa, and that would be suggestive of there being some impaction. If there is no impaction, then maintenance laxatives can be given, and that's usually Movicol, which is a combination of polyethylene glycol and electrolytes. It's essentially a sort of salty, sugary drink, which helps bring or draw water into the lumen of the intestines and hence loosen up those stools. It can also be given with some sort of stimulant laxatives as well, like senna, which actually basically augments the contractions of the intestines to try and help move things along. If there is evidence of impaction, then Movicol paediatric plain is used, and it's a 2-week escalating dose regime in which increasing amounts of Movicol is used to try and draw more and more water into that impacted stool and loosen it up. If that alone is ineffective, then a stimulant such as senna can also be added. There are a bunch of behavioral things as well that can be used to either treat constipation or prevent it. So scheduled toileting, a bowel habit diary, and some form of positive reward system can all help improve toileting techniques and behaviors amongst young children and prevent the development of constipation. Just for reference, I put a little guide to laxatives on there. So the bulk forming ones are the ones which basically lend a little bit more sort of indigestible fiber to the stools. So fibrogel is a good example. Osmotic laxatives like Movicol and lactulose work by drawing water into the lumen of the intestines. Stool softeners are kind of similar, but they tend to be more of like an oily material like glycerol or docusate, which sort of infiltrate fecal masses and loosens them up a little bit. And then stimulants like senna can actually help augment the contractions of the intestines to try and get things moving.